Assalamu alaikum. This is Adeel Ahmad Khan, a student of BS MLT 8th semester from Pahar University of Science and Technology. So my topic presentation is Brucella. We will discuss about Brucella disease, clinical pictures, its pathogens. Brucella causes brucellosis, and this brucellosis, also known as other certain name, that is Malta fever or undulant fever. So this brucellosis patient that present with the same symptoms as fever, and why it is called undulant fever, because the fever rises and then falls, so it come in a wave pattern, that is named as given undulant fever. And this brucellosis is pathogen, that is the Brucella, that has been first described by a David scientist, and it was diagnosed first in the Malta island, therefore it has been named as Malta fever. Now, the patient of brucellosis present with the typhoid-like illness, that is, the patient will present typhoid, mean that is a typhoid disease caused by Salmonella typhus. So the patient will present with the fever, malaise, anorexia, sweating, rashes, and abdominal pain. Along with that, there is a undulating fever. Undulating fever mean the fever is rising, then it come down to the normal, then the patient will feel like there is no fever, then again it will rise and again it will fall, so it will come in a wave pattern, that is known as undulating fever. And the patient of brucellosis infection will present with the triad, that is the fever, along with that there is a arthralgia or arthritis and hepatosplenomegaly. So this triad would help you to know that it could be the Brucella infection. So this is the slide show undulant fever, that is the fever rise and then again falling, coming in a wave pattern. Then there would be other symptoms like musculoskeletal system, that is joint में पेन हो सकता है, ठीक है, इन्फ्लेमेशन हो सकता है, CNS depression, because ये जो पेशेंट होता है ब्रोसीला इन्फेक्शन के, यूजुअली दे प्रेजेंट विद द POU, that is the pyrexia of unknown origin. That mean, or you can say fever of unknown region, that is कि fever आ रहा है but we are not able to diagnose. Persistent unexplained fever despite having basic investigation. So basically जो infection common है with the presentation of fever and investigation, we have done all the routine investigation but still we are not able to diagnose. Brucellosis जो है one of the most important cause है POU का, pyrexia of unknown origin का. There could be CVS, endocarditis and environmental genitourinary system. So what is this Brucella? Brucella is basically gram-negative coccobacilli. So now Brucella species, and this Brucella have various species like Brucella melitensis, Brucella abortus, Brucella suis and Brucella canis. मेनली जो है ब्रोसीला इज़ अ जोनोटिक इन्फेक्शन. ये जो पैथोजन है ये मेनली एनिमल का है, एंड वी आर एक्वायर्ड दैट इज ह्यूमन बीइंग इज एक्वायरिंग आइदर इट इज़ ऑक्यूपेशनल हैज़र्ड दैट इन दोस पर्सन हु आर कमिंग इन कॉन्टैक्ट विद एनिमल और एनिमल प्रोडक्ट, सो दे आर हैविंग दिस ब्रोसीला infection. And melitensis जो है that is the most important pathogen which is transmitted from animal to human. So this show the growth of Brucella on the blood agar media. So this is the gram-negative coccobacillus, and they are not capsulated and they are non-motile. They are obligate aerobic and they are fastidious. Fastidious means that this bacteria need enriched media for growth, and it also needs 5 to 10% carbon dioxide. Although this is obligate aerob, but 5 to 10% CO2 carbon dioxide will provide and enhance its growth. And also how you can provide this condition by using candle jar method. Antigenic structure and classification. Now, two important antigens are present on this bacteria, that is the antigen A and antigen M. And in all the pathogen, all the species of Brucella, they have different proportion of A and M. So depending upon the proportion of M, which is high, which has been seen that if the proportion of M is high, they are more virulent. Virulent means that is a chance of causing big disease more in the virulent species. That is the Brucella melitensis is very high concentration of M antigen, so therefore it is more pathogenic to the human. Now what are the different virulent factor? That is lipopolysaccharide, endotoxin. So it provides resistance to phagocytosis, suppress phagosome lysosome fusion, and also have the type 4 secretion system. So now come to the epidemiology. First of all, it is zoonotic disease. What is mean by zoonotic disease? That mean mainly a microorganism or the pathogen that is present in animal. So the animal are the reservoir, and somehow when we come in contact with them, so we can acquire that pathogen. That is called zoonotic disease. Even when we, if a question about a zoonotic disease, you can write a given example of Brucella also is that. Now, what is the source of infection? That is infected animal, and so any resources of infected animal is urine, milk, placenta, vaginal discharge. Then food product, that is cheese, unpasteurized milk, raw meat. Then people who are at risk, that is farmer, shepherd, butchers, abattoir worker. So all those who are coming in contact with the animal. So now, so how this disease occur? That is the first way occur is initial infection, and then it is passed to the lymphatic vessels, or lymphatic vessels reach to the lymph glands, and lymph glands to the blood stream, and from blood bacteremia has occurred. So all the multiple organ. So this is how the brucella is spread. That is, the brucella infected phagocytic cells are there, and infection is spread the reticuloendothelial system. So it mainly the eye system, and eye system is composed of your bone marrow, liver, spleen. So in सब में इनका brucella infection spread हो जाएगा, and also because it is causing the bacteremia. सो बैक्टीरियमिया से आपका जेनिटल यूरिनरी सिस्टम भी इन्वॉल्व हो जाएगा, मस्कुलर स्केलेटल सिस्टम भी इन्वॉल्व हो जाएगा, सीएनएस भी इन्वॉल्व हो सकता है. सो इट इज़ कैरी टू द स्प्लीन, लीवर, बोन मैरो, एंड all are these part of the reticuloendothelial system. Now this bacteria has also a predilection for placenta because it has the affinity for the erythritol, musculoskeletal system, and genitourinary system. Now, what is the course of brucellosis? That is, if it is not being treated, usually क्या होता है कि इनमें incubation period जो होता है, that is week to month. So when you are acquired that infection, immediately आपके symptoms नहीं आएंगे. It can be month के बाद आपके fever आना शुरू होंगे. So you will think कि एक simple सा बुखार आया, fever आया, and you will not go for the treatment, and you have taken simple antipyretic drug. एंड सो दिस विल कम फीवर, आया सर्वाइव कर लिया, फिर आया सर्वाइव कर लिया. सो यूजुअली एंड में हल्का हल्का पेन होने लगा है और इन्फ्लेमेशन शुरू होने लगा. सो डैट कुड बी द कंडीशन. मैनी पेशेंट कवर कर जाते हैं स्पॉन्टेनियसली, कुछ में एक्सरबेशन भी हो जाता है. सो इट में प्रोड्यूस अंडुलेंट फीवर एंड सिम्टम्स. नाउ हाउ विल क्लिनिकल डायग्नोज? डेट इज़ फर्स्ट ऑफ ऑल आपका क्लिनिकल डायग्नोज है, दैन लेबोरेटरी डायग्नोसिस है. सो क्लिनिकल डायग्नोसिस में फर्स्ट ऑफ ऑल द हिस्ट्री पार्ट इज़ वेरी इंपॉर्टेंट. History part is very important. There you will be know about the occupation of that person. So occupation is that the person is coming in contact with the animal somehow, or having some raw milk history, or having travel history, or some symptoms are chronic history. क्रॉनिक हिस्ट्री में आपको मिलेगा कि इसको बहुत पुरानी हिस्ट्री है फीवर की. सो डैट विल गो इन फेवर ऑफ ब्रुसेला के एनिमल का है, जोनोटिक इन्फेक्शन है, एंड इट इज़ अ लॉन्ग हिस्ट्री. ब्रुसेला में क्या होता है कि लॉन्ग हिस्ट्री आपको मिलेगी कि उसको फीवर आ रहा है और उसने बहुत एंटीबायोटिक यूजुअली ली है. सो डैट मीन शो कि आपका फीवर किधर जा रहा है, POU की तरफ जा रहा है, डैट इज़ पायरेक्सी ऑफ अननोन ऑरिजिन. Then you will go for the laboratory diagnosis. Thank you very much.